than for those who were below the median, suggesting that baseline BMI is an important consideration when looking at the effects of sugar-sweetened beverages on changes in body mass index. And again, they made the point about is there a difference in tendency to compensate between children with obesity and those without. In terms of ethnic group, we can consider these preliminary data. As mentioned, as shown in a previous slide, we had only 46 non-Hispanic participants. Nevertheless, this is provocative in terms of effect modification. And when we think back to the vignette of our Hispanic boy. For the non-Hispanics, there was no significant difference for change in BMI between the experimental and control group, either at 1 year or at 2 years. But when we look at the Hispanic subset of participants, we note a difference in BMI of 1.79 units at 1 year, and this difference was 2.35 units at 2 years. This equates to 8.8 kilograms. So a fairly large effect that really needs to be looked at more carefully in subsequent studies. In the New England Journal of Medicine paper from 2012, we included a reanalysis of observational data. And these were from a 19-month prospective observational study, the Planet Health study conducted by Dr. Steve Gortmaker, and that Dr. Ludwig also took a look at for a study published in Lancet. So in this study, there were 548 middle school students. We noted effect modification by ethnic group. There was a strong association between change in consumption of sugar-sweetened beverages and change in BMI for Hispanic participants, but no association for the non-Hispanic students. So again, suggesting that ethnicity is an important effect modifier. Why? I can't say with certainty, but it may be due to differences in insulin secretion following sugar consumption. Dr. Hume mentioned genetic susceptibility, such that consumption of sugar-sweetened beverages can exacerbate genetic risk for obesity, and there may be other factors influencing disparities in BMI, including socioeconomic status, early feeding behaviors. Okay, so in the last 10 minutes or so, just going to talk a little bit about translating research to practice. So starting with revisiting the vignette. A recommendation to reduce consumption of sugar-sweetened beverages is appropriate for patients such as JD with overweight or obesity. Hispanic ethnicity, family history of obesity, and a profile of laboratory values consistent with metabolic aberrations linked with consumption of sugar-sweetened beverages provide additional context for this recommendation. And we heard about these plethora of aberrations in previous talks. I'll just list a few here and note that in this vignette we saw increased triglycerides and decreased HDL cholesterol, very common profile. We saw elevated ALT, and although we did not see impaired fasting glucose, we saw a high fasting insulin level, which suggests that he may be on that trajectory. And I would also argue that for patients like JD who are overwhelmed when attempting to change dietary behaviors, a recommendation to reduce consumption of sugar-sweetened beverages is certainly a reasonable first step in light of the data documenting measurable and beneficial effects of reduced consumption on body weight. So why do individuals consume sugar-sweetened beverages? And I knew I was coming right after Dr. Manella, so I'm not going into this in great detail, but I found this very entertaining article in the Journal of Adolescent Health published by Block and co-workers. And basically it boils down, if it tastes good, I'm drinking it. This was a study done with college students. I'll come back to this study again in a moment. There's also this interesting study on salience related to branding, thinking about how that may promote habitual consumption. This was a study using fMRI to look at brain function. They compared habitual Coke consumers with non-consumers. The habitual Coke consumers were consuming more than 5 Coca-Cola Classics, 12 fluid ounce servings per week for more than the previous month. If you look over here, just anticipating Coke intake versus intake of a tasteless solution resulted in less activation in inhibitory regions for the habitual consumers. And Coke logo ads versus ads for non-foods showed greater activations in regions encoding for salience. So when counseling clients or patients, certainly understanding more about their desires for certain brands may also be an important topic for counseling and discussion. So what education would prompt children, adolescents, young adults to reduce consumption? Everybody here, I'm sure, knows this, that adolescents and young adults often dismiss the adverse effects of consumption on their personal health. They're at a stage in their life where many of them believe they're invincible. Education concerning these effects likely is an important component of intervention. But how do we do this education? In our research studies, we established this think before you drink messaging, and we put these messages on refrigerator magnets and went through a variety of different topics. Some of these topics were selected based on focus group discussions with adolescents prior to our initial pilot study. So we focused on understanding the relationship between sugary beverages and possible weight gain, how sugary beverages could decrease energy level due to the effects of blood glucose on insulin and then a blood glucose crash. Focused on how much exercise it might take to burn off the calories in a sugar-sweetened beverage. The adolescents especially like thinking about advertisements. They don't like to be misled, and when you show them how advertisements are misleading them, that tends to perk their attention. And then while our research studies have not focused on tooth decay, in our focus groups, that was one of the topics that the adolescents thought would be more motivational for them. And then we don't just focus on the adverse effects of consuming sugary beverages, but we also focus on the beneficial effects of consuming water and why water is absolutely essential for life. So these are educational materials that we made on a pretty low research budget. Since that time, we've dressed them up a little bit. So back in 2016, 2017, I had the privilege of working on what we now call the Boston Children's Hospital Fit Kit. And we developed resources for community organizations. And I don't have time to go into all of this. For anybody who's interested, I'd be happy to talk with you because I'm super excited about working with community organizations to do interventions. In the Fit Kit, we focus on fitness, nutrition, sedentary time, sleep, and stress, just to put it into context. There are 3 nutrition messages. One focuses on balanced meals, one focuses on how to pair foods to make healthful snacks, and the other, of course, focuses on sugar-sweetened beverages. So this is one of our posters. Stop and think before you drink sugary beverages. Drink water instead. Feel refreshed without the added sugar. So we'll be doing some more programming using this type of resource. I'll just give you a little bit more feel for it. These are the same messages that were on the lower budget magnets for the research studies. We've now put them into full color, and they're available to our community organizations, our community partners like Boys and Girls Clubs, YMCAs, some sports-specific organizations that we're working with. Again, just a graphic for listing some of the benefits of consuming water. And then we realized that children understand these things, but understanding something does not always translate that into behavior. So we have a series of what we call problem solver cards, and this is just one example. Because of the confusion around sports drinks that we've already discussed, we have this card where it says, I'm so confused about sports drinks. Don't I need them if I sweat? And then there's some talking points for our partners in the community organization so that they can bring the kids through a meaningful discussion about the sports drinks. So again, regarding what type of education is needed. Back to this study published in the Journal of Adolescent Health, what they found was that during focus groups, college students suggested that health messages with shock appeal and graphical representation of information would get their attention. I have to say, I've never been one of these people that liked the shock appeal thing or the graphic representation. But this is what the data show. And these are actually the ads that they showed to them, these ads that came out of the New York City campaign several years ago. So this one says, are you pouring on the pounds? And they have Coke translated into fat. I still don't know if that I like it, but it seemed to resonate with this group of college students that were participating in these focus groups, and they called it gross. And then another ad showing the number of packets of sugar that is in a classic bottle of soda, and it says, all these extra calories can bring on obesity, diabetes, and heart disease. And the comment there was repulsive. So I guess they may resonate with certain groups. It's not typically the way that I like to do education. I like to do it a little bit more, I don't know, without the grossness and the repulsiveness, I guess. So another question when translating research to science, what support do children need to reduce consumption? Again, removing sugar-sweetened beverages from the home, providing non-caloric beverages, including safe tap water, and modeling consumption of non-caloric beverages. Back to this issue of depriving normal weight siblings of their favorite sugar-sweetened beverages. I'm sure the clinicians in the group can relate to this, where there's one child with obesity and one in the family, like in the JD case, who is not obese. But certainly there's evidence that avoiding sugar-sweetened beverages prevents excessive weight gains and has a variety of other metabolic benefits that can be conveyed to parents when this concern arises. Okay, just another one of our cards. We spend some time with our Fit Kit resources